Good evening to everyone present here with us today. This is Shreyan from IGCP. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared our keynote speaker doctors for today's session. With much pleasure and honor, I would like to welcome our speakers for today's session. First, I would like to welcome Dr. DC Jain.
Thank
Welcome,
you.
sir.
Thank you very
Sir
much.
is the Thank you, sir. Sir is the former professor and the head of Neurology Department, Vardhaman Mahavir Medical College and Sartanjan Hospital. Next, we have Dr. Arun Agarwal. Welcome, sir. Sir is a medical graduate and postgraduate of King's George Medical College, Lucknow, and completed his master's in ear, nose, and throat specialty in 1976. At present, he is the medical advisor, innovation, education, and clinical excellence with Apollo Hospital Group. Also, Sir is an ex-dean at Maulana Medical College. Next up, we have Dr. Rakesh. Welcome, sir.
You.
Sir is he is an postgraduate in orthopedic and MS at Sardarjan Hospital, and currently he is an advisor in NGOs. With the help of our respected panelists and their wonderful insight, we will be taking a close look on today's topic, which is MNC, its role in changing the scenario of healthcare in India. Before moving forward, let's have a close look on today's topic. The National Medical Commission, MNC, has played a pivotal role in transforming healthcare in India. Established to replace Medical Council of India, MNC aims to streamline medical education, improve standards, and enhance the quality of healthcare service. Now, without any further ado, I would like to welcome all the speakers to our platform and like to hand over the session to them. Over to you, sir.
Thank you very much. And let me just start now. You are all eminent doctors who have been practiced medicine for a long time in your own specialty. Every one of you must be having at least about 40, 50 years of experience. You have seen the changes taking place in the overall medical health system from the time you started your career and as on today. You must have seen the diagnosis based, patient centric type of clinical practice which has been taught to you. Then, in between, you must have seen a type of high technology driven diagnostic tool supported medical care. And during last 10 years, you must have seen a large amount of digital health, artificial intelligence, and machine learning based medical care. Now, this changing scenario which has happened during last 40, 50 years in the medical care system need doctors who are trained in these type of systems. A basic doctor who qualifies as MBBS doctor need to know all those things which he has to use in his day-to-day practice when he qualifies as a MBBS doctor or when he qualifies as a postgraduate doctor. A simple example is that Government of India at present is going ahead with the national Ayushman Bharat digital health mission. They have developed an app which is being integrated at sub center and the primary health center. And this app is known as e-Sanjeevani app. It provides access to telemedicine services. Now, if our basic doctor who is sitting over there in the primary health center is not taught all these type of tech health component in his MBBS training, how can he control and use them for the patient welfare? The second thing is that you are all tertiary care doctors. You must have seen in your day to day practice a lot of changes as far as the healthcare delivery is concerned. So many artificial intelligence supported solution has come which provide you relief from repetitive tasks, which gives you help in decision making, which which helps a surgeon to navigate up to the point of surgery. So as a tertiary care physicians in your postgraduate training in the neurosurgery or neurology or ENT, if you don't train these doctors into these type of newer technology, how you can go ahead and create a better workforce of postgraduate doctor. And lastly, in situations like pandemic which has struck us recently, we have seen that to create a huge response capacity in the public health system, you have to depend upon the digital health and digital solutions. So with these things in the back of your mind, I will like to have comment that what are your suggestions for future priorities for discussion, debate, deliberation and inclusion at the National Medical Commission as on today. All these three things to create a better equipped primary healthcare doctor, to create a better specialist, and to generate a better public health response system during pandemics. Dr. Jain, please.
Thank you very much, Dr. Srivastav. You have brought out a very important issue that in the modern world, newer technological inventions have revolutionized the whole medical practice. Most of the invasive techniques of investigations, they are now replaced. I would like to quote you one example of carotid artery angiography or the vertebral artery angiography. It was a cruel procedure. Similarly, injecting air in the spinal cord and taking the x-rays like the pneumoencephalography, it was a cruel experiment. It was a cruel way of diagnosing the diseases. The modern gadgets like the CT scan, MRI scan has totally revolutionized, and now it is easier to do the diagnosis without the subjecting the person to unnecessary cruel ways of investigation. So this is a good way of. The another point which is pertinent at this point is that this will also provide a new horizon of thinking that anatomically we have been able to diagnose the lesion somewhere in the spinal cord, in the brain, or wherever the disease is there by the investigative tools. But it is still handicapped to give a pathological diagnosis without subjecting the individual to a traumatic procedure like the biopsy or the needle aspiration or even the CSF analysis. And we have to do a CSF tapping to take out the CSF and then analyze. So to replace these cruel ways of doing the investigations, diagnosing has to be replaced and has very scientifically is getting replaced. So this is a good way of approaching. So the teaching to the undergraduates and postgraduates is very important that these diagnostic techniques has to be told to the students, and their interpretation has to be taken into uh, consideration that how these investigative tools they are helping you in diagnosing the diseases. The artificial intelligence is also a new field, and it's rapidly creeping into the system. And I have seen with my own eyes that the artificial intelligence at times provides a very comprehensive review of the subject. And at times, the rare diseases, they are also being reflected, their points of differentiation. So these tools, they are going to become very essential, very important. And I feel that their introduction in the medical teaching is justified and is timely required.
Okay.
I
Thank you very much, Dr. Jain. Thank you. And now the same question to Dr. Arun Agrawal. What is the future course? What is the way forward for NMC to integrate the newer things for making a better primary healthcare doctor, a better specialist, and a better public health expert who can utilize tech health to the best for the benefit of human health? Dr.
Thank you,
Arun
sir.
Agrawal.
Thank you, Dr. Srivastava, sir. Thank you, Dr. Jain. Now, the question is that as regard this topic is concerned, India as a country is totally different as compared to perhaps the entire globe. The reasons are very simple that we have a big population to deal with. And obviously, when the population is big, numbers are big, we got to have numerous diseases with their different presentations, with their, and what we have learned during the last COVID time, that whatever has been described in medicine in their textbook, the things may change anytime. Now the question is that we are talking about undergraduate student, we are talking about postgraduate, super specialization also, as well as the public health expert. Today, we are, if I'm not wrong, perhaps admitting more than 1 lakh 10, 11,000 undergraduate students, or maybe little less than that, in various 700 plus medical colleges. A big number, the biggest in the globe. And then those MBBS students, most of them are perhaps have got a desire to go into a specialized field. And some of them will definitely like to go for public health domain also. The question is what NMC should do. What is now we are lacking, sir, you will agree with me, that an MBBS doctor is losing his confidence by remaining only MBBS. He or she finds that there is no future into it. Where perhaps we may have to change our approach. That of course one will like to become a specialized doctor, but if somebody wants to enter into professional career at the level of MBBS, what sort of teaching and confidence level we are giving to those people where they can be accepted in our society. You will agree with me. And that is why it is important that the curriculum of the MBBS is very good, there is no doubt, but can be tailored. In a way, I like to say an MBBS doctor to a status of general practitioner or to a person who is dealing with all sorts of acute emergencies, the first go, and he or she must know what they can attempt or what they cannot attempt. So there has to be like a differentiation, and then little bit public health aspect also. In a way, I like to say that a medical officer employed in the government system, though most of them are postgraduate, that is a different point of discussion. But ultimately, their minimum qualification is MBBS. So we have to create a curriculum which brings them confidence in totality when they are working as medical officer rather than in a district you are MSCNT working as medical officer, you are MD Ops Gynae working as medical officer, or you are so and so but is still working as. So an NMC must concentrate in building up the confidence level of one MBBS doctor. As regards the technology, there is no doubt and technology, it's changing so fast. To cope up with the technology with as compared to globe is a challenge, but we have to do it. But suppose I say why people are coming from villages or rural area to city like Delhi or Mumbai or Chennai, Calcutta, because they know the better technology, better investigation, better treatment. So we have to create a system of referral that is also perhaps lacking in our system. And adoption of technology is must. You have to survive, though it is cost wise very difficult to cope up with those technologies. As Dr. Jain gave the example that MRIs, and in MRIs also there are different versions and different apps, and now we can do away with all crude methods and can diagnose the things in much more less painful or least painful method. But those technologies has to be adopted. But at the same time, availability of those technologies. NMC has got their own system of creating a minimum standard. Those minimum standard has to be upgraded because whatever is minimum today may not be the minimum after 2 years. Like
I think, Dr.
radiology is
Agarwal, you are
changing.
perfectly well in saying that there is a urgent need for the NMC to upgrade its system, keep on revising it MSR, so that they
That
can
is
create medical institutions which can produce doctors which can gel with the modern technologically driven healthcare in the best possible way. Having said that, uh, you understand that uh, in India, we had once upon a time an MBBS doctor who used to feel that he is a proud entry into the health system as a primary healthcare doctor. He used to treat the patient because he had confidence of his skill and competences to tackle common conditions. You felt that now they are lacking it
yes,
because of factors which are unrelated to the tech health. They are related to the system weakness. But for
correct.
future, besides covering up all these shortcomings which are there in the health system, in the regulatory framework, if we try to look at the healthcare delivery practice in primary healthcare, we see large number of point of care devices which are used in the primary health center. Say for example, you use mobile app for ECG. When we were student, we were not using it. You have got cloud connectivity to read that ECG and give you inference whether the patient has got a heart failure, heart attack or not. We were not having it. So I want to, and I am of very firm opinion. These are the these are the technology which should be taught to an undergraduate doctor because he has to practice it. In 5 years ahead from now, they will become a routine thing. Second thing is that besides this, you have seen the tertiary care hospital practice, in which you found that as a medical doctor you had been doing very repetitive work. You will ask your doctor to write the case sheet. You will ask your doctor to monitor and write the progress report of the patient. You will ask your resident doctor to go and see during his PG training that when he go out of the ward after completion of his duty hour, he gives a medical report of each patient's in reading text form to the person who is taking over. The same thing is happening with the nurses. There is a lot of maintenance of the stocks. So much drug has gone out, so much drug is getting depleted. There is so much paperwork which is involved in supply chain management in running of a hospital. Now, what I want to convey in tertiary care or secondary care, there are large number of repetitive activities which are gradually being replaced by the technology, by the machine learning. So our specialist doctor are more spared to take care of the patient. If these things are taken care by machine learning, you must have seen large number of softwares which are there in the hospitals to take care of billing. You must have seen large number of uh, record keeping which has been digitized and taken over from the physical records. So all these things will become a commonplace and they will spare your doctors from many more type of job and he will be spared. So in the making of a PG doctor, you feel that he should be made conversant to these type of things. So all these things are requiring a revision in the MNC, in the MSR, in the UG curriculum, in the PG curriculum. Dr. Jain, I would like to request you to tell us with your observation in your past practice and your connectedness with the Director's General's office, how prepared you find NMC for handling such type of situations, sudden change which is just coming like a tsunami during last 10 years and just impacting the total healthcare system and demanding a lot from the regulatory framework. What do you see the capacities of NMC to respond to such type of drastic changes which are taking place in the delivery system of the healthcare? Dr. Jain, please.
Uh, Dr. Srivastava, you have raised very pertinent aspect of medical health care, particularly at the primary and tertiary and secondary tertiary hospitals. During my stay in the Ministry of Health, I realized that there was a need of bringing up the facilities at the district hospital levels. And I realized that at the district hospitals we have a good number of beds, good number of patient infrastructure, and I suggested that there should be medical schools in these district hospitals, which now the government has taken up and they have started opening the medical colleges. Our idea was that we have that district hospital as a nodal center where the villages, the neighboring towns, they could be uh, they could seek the medical health, medical care in those district hospitals, and the students are also taken up from those districts. And the government of India has probably done the nice job. Now they have started medical colleges at most of the places. And there was at that time it was felt that there is a financial restraint, but I feel that financial restraint was not a big problem. And the purchasing a CT scan at the cost of 3 crores and eco holter and all these equipments, they could be purchased within a limit of 10 crores. And the building for the medical schools also came up in at a cost of 2 to 3 crores. So the whole medical college complex has come up at the district hospitals, not more than exceeding the requirement of financial aid to the extent of 10 crores. This is a good way of doing the things. At the same time, now the question is of storing the data and the registration, keeping the records, and this, all these they should be digitalized. That there will be more transparency in that situation, and the expenditure will not be exorbitant as we are apprehensive to think about it. So I think that the medical system should undergo a overhaul improvement. Thank you very much, sir.
Okay, thank you. And Dr. Agrawal, and you
Yes,
had been in the council, you had been creating different type of changes. So I remember that I have seen you from the Medical Council of India for last, I think, 10, 15 years you had been associated with it. So you
yes,
understand the nitty-gritty.
yes,
You understand the capacity of responding to a situation like this, which requires rapid solutions. So how
yes,
much you feel that the present NMC with a structure of an advisory body with four boards and with the persons of high eminence as chairperson of the board, with lesser availability of younger generation and more availability of senior uh, 60 plus colleagues over there, how what capacity you feel NMC has got to respond to
I
such
can.
type of situation? And if they don't have capacity as per your impression, what should NMC do to create that capacity within them, within the overall regulatory system, so that in coming 10 years we should be able to impart a medical education which is of worth value to create a future doctor. You know, if you just look at the future doctor and future hospital, there is drastic change. All reports which are available about the KPMG and other things demand for a change. So, what is your view as far as the regulatory
I fully agree.
structures
We require a
capacity to
change.
respond?
We require a change, sir. The only thing in nutshell I would like to start with, we don't need only in numbers, we need quality doctors also. So that means whatever standards we are adopting, we are producing good doctors, but are we satisfied really? Perhaps answer from my side is no. So we have to create the numbers as well as the quality also. And once we talk about quality also, the more and more clinical exposure, more and more teaching by the side of the patient. I appreciate Dr. Jain's version that district hospital are adopted, and now NMC had made it mandatory that there should be a secondary hospital connected to every medical college. That's a good step, but at the same time, I want my student to be strength of Indian doctor is that we have a strength of unfortunate increased numbers. That is our unfortunate story. But what to do? Once we have so much of population, there has to be suffering, and that is
That's
why
right. That's
I
right.
want my student.
I think you have touched the main things of the medical education system. So we are just coming
Yes,
down to the close of the time. So at that juncture, I will appreciate. I will just conclude with a remark that there is a need to increase the capacity for the NMC to respond to such type of high value demand. And with these words, I will hand over the mic to the organizer to kindly conclude. Thank you.
Thank you so much, sir, for joining us today. And with your permission, I would like to conclude today's session. Thank you.
Thank you.